What does the situation look like now for California hospitals preparing for a surge of coronavirus patients? To find out, I went to Martin Luther King Hospital in South Los Angeles. Outside the hospital's emergency entrance, where barriers were being set up to prepare for more patients, I talked to hospital vice president Jorge Reyno. How are you preparing for the coming hours, days, weeks when it comes to coronavirus?
Like everybody else, expecting that things are going to get worse in regards to the number of cases. And we do need to be very, very careful that we're going to meet the needs of this community.
Could you just give me some idea, as a big urban hospital like this one prepares for what's likely to come in terms of patient intake, what is happening inside those walls?
We're very busy. We're managing near the top of our capacity. We innovate significantly in our ED.
ED being?
In the emergency department. And we've been doing so to find additional room, additional space to meet the volume of patients in our community that need our help. But we need to prepare for more than our capacity can sustain. And if necessary, if it comes down to it, with fewer supplies.
I mean, if there's a big surge, do you have enough stuff inside to deal with it? Do you have
swabs maintain normal
and
operations for now, we can handle some additional surge. But if, say, for instance, I think we're in the same condition as every other hospital, probably in California, probably in the country. If we were to see massive changes in a surge, it's likely that we'll fall short of some critical supplies. And so we're working actively to make sure that hopefully we can come up with some other solutions and partners.
I was talking to one of your colleagues earlier who said the hospital's actually starting to reach out to nail salons to ask them about face masks. Is that right?
Well, we're reaching out. We're asking our staff and everybody that we work with to be as creative as possible.
Really?
So any connections that we have. So whether hardware stores, any other non-traditional source that we might be able to find, we will accommodate what we need to, and we will take care of our community. But we're going to have to get really creative in terms of, where do we find the stuff that we've been relying on readily in the past. Again, that was Jorge Reyno, president of Martin Luther King Hospital in South Los Angeles. Hospitals preparing for coronavirus patients are also making partnerships. At LA's Martin Luther King, the humanitarian aid group International Medical Corps, which usually operates in war and disaster zones abroad, has opened a field triage facility next to the hospital's emergency room. As workers assembled a huge tent, IMC's Margaret Traub told me how it'll be used.
We are anticipating, with the surge of patients, to do triage, treatment, screening, because we're anticipating there's going to be an overflow in the emergency department. And so this will help add additional space so that doctors and nurses can maneuver.
And could you see it coming to a point where, people are in this tent for days at a time?
Absolutely. This could end up being a treatment area. It could be a triage area. It could be an initial screening area. But patients could remain here for a while, so they will stay here as long as they need.
Tell me about just the process of getting it up and running. I mean, IMC, International Medical Corps, moves really fast in areas all over the world. What did it take to get this up in South Los Angeles this quickly?
So International Medical Corps maintains these facilities in crates at FedEx in Memphis. We were able to ship it on Wednesday night. It was here Thursday morning, first thing, and we had it over to the hospital and are assembling it here today. So we're able to mobilize them and deploy them and be operational anywhere in the world in 72 hours.
Is this kind of a picture of what's to come? I mean, do you think we're going to be seeing, whether it's through your organization or so many others, we're going to be seeing these pop up at hospitals all over the state and all over the country?
There's going to be more and more of this, so it's something you can expect to see. It's something that's necessary really for many busy emergency departments to be able to handle the overflow.
That was Margaret Traub with the International Medical Corps.